See, RI witnessing. RI witnessing. Let us start with a question mark. Okay, like see, RI witnessing. Before that, so I'm going to discuss the safety. I'm going to discuss the 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 procedures we witness in the IVF lab, and I'm going to discuss about this. Now, what is RI witness? Why RI witness is used? Okay, how does RI witness work, and what are the hardwares which we use in RI witness? So this class will be very helpful. You might have heard about the mix-ups. You have heard about the mix-ups, IVF mix-up. Did you hear about IVF mix-up? Anyone?
Yes, sir.
Uh,
Yes, sir.
yes. So there is a lot of. I'm audible, right? I'm very much audible, right? Do I
Yes, sir.
need to
Yes, sir.
change? Okay. There is a lot of IVF mix-ups nowadays going on. Even if you see last year also, there is a lot of mix-ups that happened. Okay, for that reason, this RI witnessing system is very very important. Witnessing system, RI witnessing system. Okay, so this RI witnessing system is nothing but it is making the switch to the electronic witnessing. So humans are better than electronic witnessing, but still the humans make a lot of errors because of lot of informations. Okay. See, embryos, all the embryos in the initial stage will look same. All the embryos. The initial, see, for example, if you go for ultrasound scanning before 3 months, all will look like female child only. Okay, there is no phallus won't get developed properly. After 3 months only, that sexual organs will start developing properly. So like that, uh, if you go to the embryonic pre-implantation embryos, all will look same. Okay, you can't tell that this embryo belongs to this. It's only the labeling saves us. The labeling, the proper protocol, the proper lab protocol saves us. Okay, or it is very easy to get it mixed up. So we are going to learn the safety. Okay, and all the under these headings we are going to learn our class today. So class is very simple. You can at last you can ask me questions and please be interactive. Okay, now see why RI witnessing. RI witnessing is very important for the safety. For the safety. See how it safe. See, once the RI witness is there in the lab, an educated couple will have a lot of safety. The patient will feel very much safe. Okay, and they will assure that okay, whatever the embryos the transferred to their room, they will have 100% faith on it that their embryos belongs to those couples only. Say how they will feel safe in three ways that they can feel safe. Okay, one, patient will be provided. See, once the patient walks into the clinic, okay, into the IVF hospital, they will be provided with the unique patient card. One patient card will be given that will be that will be having a unique number which is specific to that patient's only. That number won't get repeated. So with this, if you explain to the patient will feel safe. And secondly, once the card is read, this is very important to note. Once the patient inserts the card for RI witnessing system, it will lock the workstation. For example, if I want to do as processing of one patient, for example, patient A, okay, once the patient inserts the card, okay, once the RI system is in place, you can process only one sample. That's all. Just a just a minute, doctors. I'm getting a call. Yes, ma'am. Yes, ma'am. We can do, ma'am. No issues. We can do, ma'am. Okay, ma'am. We can do. No issues, ma'am. Oh, second. Okay, ma'am. Done. Okay, okay. Done. Sure. Okay. Okay. Sure. Okay, okay. Done. Okay. Sorry for interruption because I got an important call from madam. Students, I'm audible, right? I'm audible, right? I'm audible, right, students?
Yes,
Yes,
sir.
Okay, okay. So once the card is read, okay, it will lock the workstation. Workstation in the sense where we process the embryos, okay, where we deal with the embryos. It will lock the workstation only for that patient. If I keep anybody else sample on the workstation, it will start beeping. Okay, so at that time you can process only one sample. With this also the patient will feel lot of safe, like they can trust us. Okay, and thirdly, no, see, usually we need to have one witness, one junior embryologist or one senior embryologist we need while we are processing the sample. Whereas when we have this RI witnessing system, we don't have to have a second witness. This RI witness itself is an witness, which can witness us properly. Okay, when we are doing the procedure. So with this, patient, when we explain these things to the patient can also witness this. Okay, and the patient will feel safe that no, she or he can be very peaceful. Okay, they can make themselves very confirm. They can make themselves confirm that they are not going to face any problem while they are doing the procedure.
Sir, you are not audible.
Like how it is safe, all those things we are going to discuss now. What are the forensic 10 procedures can be witnessed by RI system? So what are the 11 procedures what we can witness there? One, collecting eggs. So egg collection can be witnessed. Okay, so if there are two three OPUs on same day, okay, egg cannot get mixed up if there is an RI witnessing system. Okay. Secondly, collecting sperms. Okay, the sperm which is collected, that also can be witnessed. Thirdly, like you know, this is sperm preparation after preparing the sperm. Okay, that also can be witnessed. Okay, and fourthly, the IVF and ICSI procedures also can be witnessed by the RI system. Fifthly, transferring the gametes from one dish to another dish. This also can be witnessed. Okay, and sixthly, like during the embryo transfer. Okay, if there are two three embryo transfer, the embryo transfer also can be witnessed by the RI system. Okay, and here I again see this prepared semen sample. Okay, will be kept in the RI witness for identification. Okay, so before insemination, this RI system can witness the sample. The eighth one, placing or removing the gametes into the cryopreservation. So the straws also will be coded with the RI witness. The straws. If you keep wrong straws for thawing or freezing, it will give beep. Okay, it will not allow to process the sample. Ninth one, disposing the gametes. See, sometimes they will, a patient will give the consents to discard the embryos or no, to discard the oocyte or sperms. Before discarding, see, we may sometimes discard wrong samples with similar names. Okay, so that also can be avoided with the RI witnessing system. And coming on to the 10th point, transporting the gametes or embryos. See, sometimes some clinicians, some clinicians, what they do is that they tell that means, for example, some patients they want to transport their embryos to other centers for the transfer. Okay, during that time also that there can be a mix up of the embryos. If this name is similar and documentation is not proper. Okay, so during that time also, what we can do is that, like, this RI system can witness the proper embryo straws for transportation. And finally, during the cytoplasmic transfer, see, we do some advanced technique called a cytoplasmic transfer. We transfer the cytoplasm of one oocyte to the another oocyte. Okay, it is rarely done, but we do this type of procedure, okay, to increase the rate of fertilization. Okay, so in this scenario also, to avoid the wrong cytoplasmic, because oocytes will look similar. Okay, all other oocytes can look similar. Okay, so to avoid the wrong cytoplasmic transfer from one oocyte to another oocyte, the RI system will help. So these are the 11 things I have noted. So in general, what I can say is that you will be in safe hands. The embryologist will be in safe and the clinician will be in safe. And if you implement the RI witnessing system, everything is monitored here. Okay, so this is one. Coming on to, first I've told you how it is safe, and secondly, what are the procedures can be witnessed. I told you two things. Now let us come to RI witnessing system. What is RI witnessing system? What is RI witnessing system? RI witnessing system is an electronic witnessing system which can witnesses mainly two things. One, okay, means it can be used in the IVF laboratory. I can tell you the RI witnessing system is an electronic witnessing system used in the IVF lab. And secondly, it is designed, this RI witnessing system is designed to minimize the error that can occur during the ART treatment. So mainly the mix up happens in the ART treatment. Okay, so see, when the embryologists do the lot of more number of cases, there is a high chance of mixing them. So this RI system, by definition, it is used in the embryology. It is an electronic witnessing system used in the IVF lab to minimize the errors. Okay. Now, coming out of this, why RI witnessing system is important here? Why witnessing system is important? For three things. Okay. I've listed three reasons. One, RI witnessing system supports and guides the embryologist. Okay, so very important. It supports and guides them. So embryologist will be in a safe hands. So they won't get mixed up. Now, how they will mean safe? I have listed under two headings. One, see, embryologist, it will precisely monitor the sample. Okay, so that's, for example, if the embryologist is moving the sample from one dish to another dish, he can be totally confident that this embryo belongs to this patient only, or else it won't allow to transfer. Okay, and secondly, transferring the embryos. As I already discussed in this, what are the things can be witnessed while transferring the embryo from one lab to another lab, or while transferring the embryos to the patient's womb. The embryologist will have 100% assurity that this this embryo belongs to this patient only. So hope you have understood why RI witnessing system is used. Any doubts here? Any doubts, students? Any doubts? Any
No, sir.
doubts? Okay. Now, secondly, since it is a fully automated system, okay, it is a fully automated system. Okay, what happens? It works 24/7. It won't get shut down. It works 24/7. Okay. Now, thirdly, it improves the efficiency of the lab. This is one of the very important thing we have to notice here. It improves the efficiency of the lab. How it improves? It improves by 5 ways. I have listed 5 ways how it will improve. One, 100% safeguarding the patient sample. Okay, it 100% safeguards the patient sample. One. Secondly, by this, okay, we can believe the lab. Secondly, by saving time, it saves the time. Means it reduces the time spent by manual witnessing. So we have to write, we have to know again and again, repeat it. All those things we usually do in our labs here. So all those things are avoided. It absolutely saves the time. Okay. Thirdly, it removes the potential human errors. You know that how much ever the humans do it perfectly, still there will be some errors. Okay. And see, there is something called as quality assurance. The quality assurance means how to say, the belief between the clinicians and the embryologist, and I can say the trust between the clinicians and the embryologists, the trust between the clinicians and the patient can get improved by this RI witnessing system. Fourthly, okay, documentation of the each procedure and processes can be done precisely. Okay, for example, when the embryologist has done the ICSI, when the embryologist has loaded the embryos, when the embryologist has frozen the embryos, everything can be documented pin to pin. Okay, and this precise documentation, this enables three things. This I've listed step by step. Okay, collecting the data for the research work means all the documentation work means documentation will allow to do further research. Like for example, if you get some comments, for example, if you have got common failures or common good updates of the patient. For example, common you have used one new drug, okay, but the outcome is good for the particular number of patients, so you can collect that and you can publish it. Okay. Secondly, precise auditing in the sense it helps to see, it helps to one for the negative analysis. So if your lab is getting a lot of negative results, it helps for the negative analysis because there is a documentation is proper here. Since the documentation is proper here, the negative analysis, the precision of the negative analysis will be good. Okay. And secondly, we can improve the SOPs. Okay. See, for example, if the time taken for the denudation is more, okay, for example, so we can change the SOPs there. Okay, we have to change SOPs. Okay, let us reduce the time for denudation further. Okay, so that can we look for good embryo outcome, all those things. We can change the SOPs of the lab. Okay. And thirdly, it enables the traceability of the consumable. This is one of the challenging in IVF lab. Sometimes we use a lot of consumables, it is not traced. It is not traced unless and until the lab is very good, equipped with the good SOPs. Okay. So the traceability of the because all the consumables we are using in the lab, it is imported consumables. Imported usually, developing country as well as underdeveloped country won't produce any IVF consumables. Okay, usually the consumables are imported from the developed countries. Okay, so the traceability, because since it is very costly, we can trace the consumables, how many consumables we have used by using the RI witnessing system. Okay. Secondly, uh, documentation and the procedure means procedure and process. What are the documents the RI witnessing system collects? It collects 6 documentation from the patients. One, ID of the patient. Okay, it registered permanent. And secondly, the patient name will be precise based on this ID. It will create the barcode. Okay. And thirdly, the sample type, it collects the sample type, which sample he has given. Fourthly, like time of entry, the patient enters the work area, the patient enters the hospital, that is recorded. Okay, that is recorded. And fifthly, time spent on the work area. What is the time duration the patient was inside the inside the clinic or inside the hospital premises. So all this can be recorded. And sixth one, like matching or mismatching, also can be recorded by the RI witnessing system. So all these will be recorded so that the trust between the embryologist, clinician and the patient will be more strong. Okay. Now, see, I told you it improves the efficiency of the lab. First, I told you it 100% safeguards the samples. Secondly, it saves the time. Thirdly, it improves the no, it removes the potential human errors. Fourthly, documentation. And fifth one, it helps to streamline the process. Streamlining the process, like protocol has to be followed strictly. For example, there cannot be any shortcuts. You cannot do any shortcuts because you are monitored by the electronic system. Okay, so the protocol will be followed strictly. Okay, so to implement the protocol strictly, it is better to implement the RI witnessing system, because see, one procedure, no, you can do it in 5 minutes. Again, the procedure can be do it. You can do that same procedure for 10 minutes by using the proper protocols. Okay, so these are the things you need to be um, knowing, because in case if they ask an exam, what are the why we use RI witness system? These are the following reasons. So there are many reasons. I have just listed only 3 reasons. Okay, so this is a thing. Now, I told some brief about RI witnessing system. So can anyone say how RI witnessing system will work? Can anyone say how RI witnessing system will work? I told what is RI witnessing system. I told why RI witnessing system is used. Can anyone say? Just for interaction, no, not for the no answering properly. How RI system will work? Anyone? Now you got the rough idea, no? What is RI system?
So the RI is one of the recent innovation in the clinical practice. So basically, works. It is it is working for the patient safety as well as for the clinician safety.
Yes, yes. All those, doctor. Very nice answer, doctor. How it will work? What will be your assumption? How it will work? Today,
Sir,
see,
sir, it is
for
a
example.
software, I think.
Wow, very nice. Doctor, see, for example, if a patient comes to a hospital, first he has to go to the reception, she has to make a file. Okay, then either she has to go to a counselor or directly to the doctor. Correct, no? Okay, before going to the doctor, there may be some protocol to check. So, how RI system may work? One thing is software. Very good answer. Second, anything? How it can work? Like that, like how I told you, first they have to make a file, then they have to go to the doctor. So before going to doctor, they have to meet sometime, they may have to meet counselors. So like that, how it may work, RI system.
Sir, it is a software, I think, and individual for individual patient, because each patient will give an individual number.
Okay.
And it is uploaded in the system somehow, and it will all through the monitor the total work, total system of that particular patient individually.
Excellent, madam. Very nice answer. Anyone can add to this madam's question answer? Can anyone add something little bit more? Little bit more. Anyone can you add any further points? Hope I'm audible to everyone.
Yeah, sir.
Hope I'm audible.
It is
Yes,
one
sir.
of the it is one of the witness system which is based on electronic, that is radio frequency identification.
Okay, okay, okay. Very nice. Radio frequency identification. Okay.
And
Okay.
it gives the responsiveness as well as the it will give the confidentiality to the patient. I think
Yes,
if
yes.
there is
So anyone, see, only two doctors are answering. From the last class also only two were answering. Anyone, can you unmute and know, just tell me something else about RI witnessing system, because now I'm going to take something so interesting. How it is done, practicality. I'm going for the practical thing of RI witnessing system. So anyone like Dr. Amrita or Divya, Dr. Divya, can you please unmute and talk to me something about the RI witnessing system? Because can you please unmute and talk to me about RI witnessing system? Please, no, don't waste my time, please. Okay. Hope I'm audible, no? I'm audible, right? Students, I'm audible, right? I'm not talking to a computer, right? Am I audible, everyone?
Yes,
At
sir.
least,
Yes, sir.
at least unmute and tell me, no, everyone.
You're
Okay.
audible, sir.
Okay, okay, thank you, thank you. See now, RI witnessing system. See, first one, let me show you one small video before that. Okay, one small video. Just go through this video. Please take down the notes, okay? If you want, if you can't remember, please take down the notes. This is in different language, okay? I don't know which language is this. Doctors, Did you understand something? You understood?
Yes, sir.
What you have understood? Just I just want others to answer. Like, can Divya Nagaraj, can you please unmute and just tell me what you have understood from this video? Just 1 or 2 minutes only. After that, I'm going to start my class. Please, Divya Nagaraj, can you tell me what you have understood?
Yes, sir. Good afternoon. Hello.
Yes, tell me shortly what you
Yes,
have
sir.
understood.
After watching this video, that means like each patient has their own identity. Like we can't mix the samples of some other semen sample for the other female partner. So it is very unique. So even in that video we saw there was like the purple vial was not, it was not taking the purple vial. That means it's a software which can identify specific patients. It's very
Wow, nice,
particular for one patient.
nice, good. Can Amrita, no, can you please tell me what you have understood from this? Can you please unmute and tell me? Amrita. Okay. So, doctor, like I think no video can even the language. What was the language there? What was the language? It was German language or what? What was the language? Anyone? You know what was the language they were showing? See, even though the language was different, but still, like we were able to understand what they're doing. Okay. So now let us see what is happening in the RI witnessing system here. So first a patient, okay, each patient is assigned on an ID. When the patient walks in, each patient is assigned an ID. This is an overall view I'm giving you. Each patient is assigned an ID, and after step 2, that ID number will be assigned to the dish as well as tube, okay, where we are dealing with the embryos or the sperm. Okay, and step 3, okay, this in the same tube we pour the patient samples, okay, where the sample is also witnessed, like no the once we pour the sample to that same coded uh, RI witnessing system, okay, the coded barcode, no, for that same we pour the sample and we try to utilize the same coded dishes to handle the sample here, okay. Then even for the ICSI procedure, this ICSI procedure, see, after we may go for IVF or we may go for ICSI. Okay, so that will also identify the barcode. No, the barcode will identify whether the same patient or not. So again, the ICSI will be um, safe here. Okay, now, and fifthly, if in any case if the barcode is not matching, okay, either the sperm or with the oocyte, okay, that will immediately show this mark, caution mark, and it will reject. And finally, this identity, whatever they are giving here, it can be used for all the purposes, okay, including the ICSI or IVF, till the end. Means for cryopreservation also we can use it for transfer also. So what I want to tell in summary is that this can prevent the IVF mixing, okay, embryo mixing. Now how does the RI work? So this is an overview. This is an overview I have given you how the RI works. See, start of cycle. Okay, so beginning of the cycle, what the patient does? Okay, each couple is assigned an ID card. Means a male is assigned an ID card, a female is assigned an ID card. ID card will contain a personal code, unique. It will be unique for this patient only. This ID card to be presented at the time of egg retrieval or during at the time of eating. So they have to present this ID card for RI witnessing system during OPU, egg retrieval, nothing but OPU, and during the embryo transfer. This is the first step when the patient comes. Now, second, how it works. Okay, during OPU and the sperm preparation. So RI witnessing system, no, RI witnessing ID tags, all to identify, it can identify, track, and record when the gamete and embryos are moved from one dish to another dish at each step of the process. So it once this barcode is assigned to the dish or the tube, okay, it can witness, that even the timing also, even the timing, and it can identify, it can trace, okay, what all things we have done inside the lab. Now this is the second one. Thirdly, mismatch. If there is any mismatch, okay, for example, instead of A, if we bring B, it is mismatched here. So A only will match it. So it is very precise. So if there is any mismatch, immediately it will give a buzz. It can give a lot of noise. So that we have to be very cautious. We have to be very careful that there is some mistakes has happened, and we have to go again and analyze what mistakes what we have done. And very important thing is that two samples of different patients cannot be worked at the same time, one at the time, one patient, one sample only. Okay, and insemination. So RI witnesses and validates the identity of the sample. One, okay, during insemination, allows you to proceed to the next step. As means what I can say, this RI witnessing system, no, from the beginning it traces, okay, till the end of the procedure of the particular day, it traces. So during insemination also, means during IVF in in vitro fertilization. See, there are two things, IVF and ICSI. During insemination also, it can monitor which sperm is going to the egg. And during embryo culture also. So the location of the embryo, activity, and operator's ID is logged. Okay, whenever it is brought into the work area. So it can, what I can say, the location of the embryo, where you have loaded the embryo, whether the same straw we have used or different straw we have used, everything can be monitored. So finally, no, this RI witnessing system can be used in biopsies. Okay, so there is high chance. Sometimes we may miss the embryo and we may dissect other embryo and send to the biopsy. So during biopsy, it will help. During transfer, it will help. During cryopreservation means freezing the embryo. Okay. During these times, it can help. Okay. Now, important. Now, what is RI witnessing systems? Can you see here? This is a hardware. Okay, where we can place 5 dishes. I show you in a brief. See, this is an hardware of the RI witnessing system. It can be placed in the workstation. So it can be placed on the workstation, where we can place 5 dishes here, 5 dishes of same patient. Okay, and this is a stereosome microscope. Okay, when the moment we place the dish, all the credentials will come the patient. And here we usually place the semen sample. Okay, sperm sample here. Okay, and this also is monitored. So this workstation of RI will monitor everything of a same patient. Okay, and you can't place another sample here and do the processing. So this is the somewhat in a precise way I've taken. So this is an RI witnessing table. You can see here the moment you place it, immediately it displays everything about the patient. Now let me give a brief idea how the RI system is used inside the lab. Once the patient is assigned, okay, once the patient is assigned for OPU, the patient ID is given. See, whatever I have put in this color, no, this is an RI witnessing system. Patient ID is given, and even this sample is semen sample is collected, and semen preparation is done with the help of RI witnessing system. Now, after OPU, we can go either for IVF or for the ICSI procedure. Okay, and this egg dish where we kept, no, it can be witnessed by the RI witnessing system. So hope we have understood here. Now, what we do, we RI witnessed sample, the semen sample, we use it for either for IVF or for ICSI procedure. Then FERT check is also FERT check. It is also witnessed inseminated dish. So what we do after doing this procedure, we keep the embryo for embryo culture. Okay, we keep embryos for embryo culture, which is coded with the RI witnessing system. Okay, we can, by doing FERT check also, we can confirm this sample belongs to the same patients. Then after post ICSI also, ICSI dish also can be coded with the RI witnessing system. After post ICSI, again same thing, fertilization we check. Okay, we check fertilization. Then after that, after day one, this we do it in the day one. And then day one, after that we keep it for embryo culture. This embryo culture dish also can be coded with the RI witnessing system. Then what we do after means on day 3, on day 5, we can prepare for embryo transfer. So again, this embryo culture dish, it can be coded with the RI witnessing system. And embryo freezing. See, sometimes if there are too much of embryos, few embryos we freeze it after transferring. Okay, so how to prepare this RI witnessing system dish? So we in from this dish we have to freeze the embryos. Again, what about this cryo device where we keep the embryo for freezing? It is also coded with the code. It is coded with the RI witnessing system. See, what we do is that usually we transfer the embryos from the culture to the embryo freezing media, that is cryo dish. Once we put the embryos into that, that also can recognize the RI witnessing system. Okay, RI witnessing. Then we label this same, that coding can be given same to the cryo device where we keep the embryo. Okay, so we will freeze the embryos with this. While thawing also, we can select the same cryo carrier means the straw. It is nothing but it's a straw where we keep the embryo. We can thaw by using this RI witnessing system only. Okay, and after thawing, again we can transfer for the embryo culture dish. Okay, for transferring the embryo. So finally, the embryo can be transferred. See, from here only we are witnessing with the electronic device. Okay, the RI witnessing system. We can shift into the embryo. Means there is something called as a culture dish. Okay, before transferring the embryo, we can shift into that. That also can be coded with the RI witnessing system. So finally, the patient also will confirm here whether she has got same embryo or not. Okay, you might have seen in the video, the patient can monitor whether she has got same embryo or not, or whether there's any mismatch. So this is a summary which I have given. Here what I want is this class is very simple to understand. So here what you should know that what is the importance of RI witnessing system, how it works, okay, and what is RI witnessing system. So this is very important to know. So hope you have understood the class today. Okay, hope I have covered everything here. I showed you the hardware. I told you how it works. Any questions now? Any
Sir,
question? Yes.
sir, my question may be silly, but I want to know.
No
Sir,
issues, madam. No issues. You can ask any
sir,
question. No problem.
in 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 India, donor IVF or HCs or donor embryo transfer is permissible. For if RI witness system is established in one center, how can they go for donor
Madam,
oocyte?
here what we can do, see, RI witnessing system, like it is given to the patient. For example, if a donor walks into the clinic for donation of the egg, okay, that egg will be given to a particular patient who had already given the consent.
Okay.
Understood.
Yes, sir.
That patient is coded with the RI witnessing system. That patient, not the donor.
Yes, sir.
Okay, donor will be not knowing anything. Donor, she just donates and she will leave the premises.
Yes, sir. Or donor will be anonymous.
Anonymous, that's it.
Yes.
Okay, any questions? Any other questions? Any other questions? If you don't ask question, I'll ask you a question. Any questions, doctors? Okay. Finally, can you tell me what is the full form of RI?
Sir, I also
RI
wanted
what?
to ask that question, that what is the full name of RI?
You, doctors, you, anyone can unmute and ma'am, you are very, okay.
It's about
Anyone,
radio frequency, sir. It's about
what is R and what is I? What
it's
is
about
R and what
Reproductive
is?
intelligence.
Huh? I told everything now. Now you don't know the full form of RI, doctors. Okay. So R is radio frequency, I is identification. I think doctor has told the same thing. Correct no? So R means radio frequency identification. We say RIID. Okay, RIID. Okay. So radio frequency identification number. So hope everyone have understood the class. Something you got, doctors, because here what is very important, this everything is software based. You should know what are the procedures we monitor, what is RI, and you should know what is RI, why RI is used. Okay, this question, this why RI is used is very helpful because they can ask you for short note. Okay, firstly, it witnesses, means it supports the embryologists and clinicians, and it is fully automated. It can witness 24/7, and it improves the efficiency of the lab. How it improves the efficiency of the lab? It safeguards the lab, it saves the time, it removes the potential errors, it helps in the documentation, it helps in streamlining the process, like to follow protocol religiously without any deviating. Okay, you should, there is no deviation of the protocol at all here if you use the RI witness system, because the embryologist who is doing the procedure is witnessed by the RI witnessing system. Any mistakes if we do, it is witnessed in the RI witnessing system. Okay, so any doubts, doctors? Any doubts? So what it is, this is very important. Why RI witness is used? What is RI witness? And what all things it can witness? So these three are very, very important. I'll share you the PDF of this. PDF of this. Okay. Any questions? Doctors, any questions? Can I log out?
Yes, sir.
Yes, thank you for listening. Thank you. Even though this topic was not interesting, hope everyone were attentive. Thank you. Thank you very much.